Hi, everyone. This is Janet Hill with the Rock Island County Health Department. Thank you for joining us today. Today we are with Dr. Katz of the Scott County Health Department and Dr. Olutade, the medical director at the UnityPoint Trinity Health System. We are talking about the Omicron variant and quickly rising case counts here in the Quad Cities. Nita, let's go ahead and start off with Rock Island County numbers, please.
Sure. This afternoon, we are actually reporting 172 new cases of COVID-19 since our last report on Monday. So those numbers, those daily numbers have gone up significantly. And now we have a grand total of 20,472 COVID-19 cases since the start of the pandemic. In Rock Island County, we have a total of 385 deaths from COVID-19. And there are currently 40 people hospitalized in Rock Island County with COVID-19.
In Scott County, we have had a total of 27,227 individuals reported as testing positive for COVID-19 since we began. We are in a double-digit positivity rate at this time and continue to remain in the CDC's red level of high transmission. We've had 295 deaths during this pandemic time period.
Thank you, Amy and Nita. We'll next hear from Dr. Katz with some prepared information.
Okay, is my audio working, Brooke?
Yes, it is.
Okay, well, so I was asked to say a little bit about Omicron, and I will do so. I'll try not to take too long. So in contrast to the beginning of the pandemic, where it took us literally months to understand what was going on, colleagues in South Africa have taken actually less than 2 weeks to recognize and notify the rest of the world about this new variant, Omicron, that we're concerned about because it has a high number of mutations, over 50 in total, some of which have been shown with previous variants to be associated with greater transmissibility and perhaps some evidence of immune escape, that is the ability to evade immunity from prior infection or vaccination. I think we should applaud and congratulate the folks in South Africa for their transparency in this. So we have what looks like early warning. There's a single case reported this afternoon in the US on the West Coast, 2 in Canada, in Ontario, in North America. Many more cases in the European Union, which we suspect we would expect to occur since there's really significantly more travel between the EU and Southern Africa than to the US. Surveillance systems around the world are in a decent position to recognize it. A lot of what are called sequencing tests being done routinely to look for new variants. And there are technical characteristics of Omicron that make it, in many of the PCR systems that are in wide use, fairly easy to suspect. So I think we're in good shape. Locally, state lab at Oakdale in Iowa is sequencing 300 positive tests per week, randomly selected around Iowa, and will recognize Omicron if it happens. And Public Health in Illinois doing somewhat larger numbers based on their larger population. So it's going to come here, I'm confident. I'm also confident we'll know it fairly quickly. Sequencing takes days to get results, so it can't be the only intervention that we do. We really need to pay attention. What we need to know is whether when it gets here and whether the characteristics of the virus will allow it to compete with and even outcompete Delta, replacing Delta, which is essentially everything that's being seen in the upper Midwest at this point. That's number one. We need to understand, does it cause disease that is distinct from, and most particularly more severe than what we've seen with Delta and prior variants? We really have no useful data on that subject at this point. There's some early data from South Africa suggesting it may be less severe, but because of differences in characteristics of the population, age, underlying disease, extent of vaccination, all those sorts of things, just not useful for us to even try to begin to answer the question of what kind of disease it's going to cause. And then critically important is whether prior infection or our authorized and available vaccines will continue to provide the incredible protection against hospitalization and severe disease that we've seen really so far. It's characterized, as I said, by a lot of mutations. So concern about its escape from established immunity is a critical area of study. Probably 2 to 3 weeks to have issue. A time frame of several months will be required to reformulate vaccines if that's necessary. So this data needs to be developed as quickly as possible. Most of you are probably aware that the FDA's Antiviral Drug Advisory Committee yesterday very narrowly recommended an emergency use authorization for the Merck drug. I think that's what the FDA will do. I also think it's going to come with a lot of caveats and limitations. Pfizer has a drug coming down the pipeline that my reading of the early data that I've had access to looks far more promising. So oral antiviral drugs for the unvaccinated and for those who have not or cannot respond to immunizations may be very, very important in coming weeks. It's important to note that the vaccines to date have demonstrated excellent activity against all the variants, including Delta. And what we're seeing in terms of breakthrough infections, in fact, is primarily more due to time since immunization than it is to any problem with the variants that we've dealt with so far. Whether that will be the case with Omicron is not clear, but primary immunization of everyone 5 years and up remains, I think, the critical individual and population priority. Those who've completed the primary boosting or additional vaccine doses, I think should avail themselves of the opportunity to be boosted with deliberate speed, but not at the expense of the capacity to complete primary immunization series. I think travel restrictions are prudent while we determine the extent of spread of Omicron, as is monitoring travelers from places with substantial Omicron activity. Hopefully they will allow us some time to limit the spread as Omicron is introduced into the US. You're aware of the presidential proclamation that has suspended travel of non-citizens from, I think, 8 Southern African countries. So non-citizens will be prohibited in the short run. I don't think that's going to be important for very long. My guess is that the virus is already loose in the world, so we need to use other means over the medium and longer terms. CDC is coordinating surveillance of returning travelers who are allowed to enter the US with state and local public health departments, and both Scott and Rock Island counties will cooperate with that. Bottom line is it's time to double down on the use of our non-pharmaceutical interventions while all this data develops. Mask in all public indoor venues, continue and increase social and physical distancing, and use common sense, personal and environmental hygiene. That's all I had to say. You want to do questions now or at the end, Brooke, Janet?
We'll do those at the end. I am going to share the epi curve if you want to point anything out. Can you see it?
Yeah, it's ugly. What else to say? We're on the way up in the post-Thanksgiving time. We were going up before that, I think, due to non-compliance and non-requirement for non-pharmaceutical interventions, and what I consider a pretty dismal vaccine uptake in the United States.
Sorry, we lost your audio there for a second. Dr. Katz? Not sure. Dr. Katz? Okay, we'll give it a moment there. If he has something else to add, we can do that after we have Dr. Olutade speak. So Dr. Olutade, we'll have you talk a little bit about what we're seeing here in our hospital systems and what the experience specifically is right now at UnityPoint, and any pieces of information you have for our community that can help assist us in supporting your infrastructure there.
Hey, thank you, Brooke. And as the graph that was shared just a few moments earlier revealed, we're seeing a higher rate of positivity over the past 3 weeks, way before Thanksgiving. And as we know that as people get positive test results, hospitalization rates will rise within a week to 2 weeks. So what we are seeing is that over the past 2 weeks, we've had a more than 50% rise in the number of patients in our hospitals. And yes, it's not the trend that we want, but that is the reality. And that is why we're seeing today our numbers in the 50s within our health system in this region with COVID-19, and with about a quarter of those in the ICU. So we also have sick patients and among the COVID-19 patients. And I would add that it's not just the COVID-19 that is making us quite busy. It's the other diseases. People are quite ill in general and are presenting to us overall sicker. So yes, we're heading the wrong, not the desired direction, let me put it that way, in terms of hospitalizations, and which is why what Dr. Katz was sharing is very important and critical, is that we have very great tools, resources. The vaccination is number one. And if you've been vaccinated and you're due for a booster, yes, you should be doing that. You should be getting that now, because the time since immunization matters. At least we've seen that with that's what we're seeing right now. And we've seen some breakthrough cases, and the breakthrough cases have been predominantly in those who have been vaccinated over 6 months before reinfection. So it's not the easiest of times, I would say, but we still have the capacity, we have the resources, we have the tools, we have the ability to redeploy tools and resources to the places that need those the most. So again, we've seen the average age of hospitalized patients going higher, partly due to some breakthrough cases we've seen in the older population as well.
Thank you so much for sharing the perspective of what we're seeing right now within our health systems. And now we'll try to get some public health perspective too here locally. Nita, if we can have you jump on and give some information about what's taking place in Rock Island County.
Sure. So we are doing vaccination clinics. I want to stress that first and foremost. We do them on Tuesdays and Fridays here. And on Tuesdays, we offer the Moderna or Johnson & Johnson vaccine. And on Fridays, we are doing Pfizer vaccine. Those are walk-in clinics from 9 to noon and 1 to 4. And the last couple of weeks, we've been averaging a little over 200 vaccinations a day, which is up from a few weeks back. So that is very good news. And of course, we all have to continue to prevent the spread of COVID-19 by getting those vaccinations as soon as you can. We are also offering kids 5 to 11 vaccinations with the pediatric Pfizer vaccine on Fridays. Those are by appointment only. We do have a clinic this Friday for kids. It is full. We are giving the second dose for anyone that was vaccinated on November 5th or November 12th. So it is now time for them to have their second dose. And so that clinic this Friday is for second dose only, and that will get them fully vaccinated before the upcoming holidays here. So we're happy about that. Also, of course, with COVID-19, we recommend staying home if you are sick. And if you develop symptoms, certainly to get a test done for COVID-19. We also stress, just as Dr. Katz mentioned, wearing the face masks. There are mandates in Illinois to wear face masks in indoor public spaces. And of course, the physical and social distancing and washing your hands frequently.
Thank you, Nita. Now we'll bring Amy back to share some information for Scott County and vaccinations and availability here.
As you've heard from all of our partners, vaccinations are the strongest weapon we have against the emergence of new coronavirus variants. And the good news is that the vaccine is plentiful in our community. Boosters are recommended for all adults 18 and older at this time, and we anticipate further groups to be eligible as we move through this pandemic. You can get a booster Pfizer, Moderna, or Johnson & Johnson vaccine at many locations in the community. Just visit vaccines.gov to find the type of vaccine that you are looking for, whether it's your booster or your primary series. The Pfizer vaccine for kids 5 to 11 is also plentiful. In Scott County, Genesis, UnityPoint, and community healthcare, as well as a number of other family practice and pediatric providers and pharmacies have vaccine and are currently scheduling appointments. We know that about 45% of our 12 and older population is not fully vaccinated at this time. If you have started the series but didn't get the second shot because you heard it was bad, now's the time to do it. Everyone feels differently after getting their vaccination. If you are still considering the vaccine, talk to your healthcare provider and get your questions answered. These next months of spending more time indoors, more gatherings, and more illness in general make this time of year extremely busy for our healthcare providers, and we do not want them to be overwhelmed. We've been encouraging vaccinations since the beginning of the year, and I can't imagine a circumstance where we won't be encouraging them as our key tool in the pandemic in the months to come. Get vaccinated and get boosted.
Thank you, Amy. So far, we have one question from our partners, and Dr. Katz, looks like he might be. We'll see if we can get him to answer a question here. This was regarding some of the peaks in the graph in September and another likely from Thanksgiving. Amy, maybe you can address that a little bit.
I'll take it. So this is the epi curve that we are tracking. It's from July 1 through present day. And so it is based upon the Delta surge. So we've had multiple peaks throughout this. Certainly the worst was last November as we had all of those cases. That peak that you're looking at in September is the second worst peak that we've had here locally based on that Delta surge. And as we're looking at the numbers, we're hoping that we don't exceed it with this new surge as we're moving forward into the post-Halloween, post-Thanksgiving, cold weather, gather indoors time of the year. So that's what we're seeing.
Next question we received is if you could estimate, do you think the Omicron variant will reach the Quad Cities soon? And how will that affect us as a community?
Is that for me?
Sure
yeah.
is.
I'm sorry, I was on another call in a blood center emergency. It will get here, I'm pretty sure. I don't know when. At this point, if we see a case, it really doesn't influence how we're responding to the pandemic just yet. The things that we talked about, immunization and non-pharmaceutical interventions, are what we're going to say, whether it's here or not here. So the message is, I don't like to be boring, but I will be. Get vaccinated, wear masks, don't go out if you don't have to, and the things we've been saying all along.
Thank you. And I think you already addressed the earlier question about some of the additional pharmaceutical pieces that were there and what's taking place. So I don't.
Yeah, I'm very excited about the Pfizer drug. The Merck drug has issues with effectiveness that we really don't understand even after an all-day meeting yesterday, the FDA's advisory committee, but is likely to be useful in some populations. So that's going to move very quickly between now and the first of the year.
Another question, do you see our vaccination rates increasing at any point? And if not, will we continue to see more and more variants pop up?
Well, taking off my health department hat and putting on my ID doc hat, immunization's been kind of stalled out for weeks and weeks and weeks, not just in Scott and Rock Island County, but all over the country, really. And my strong recommendation to anybody who asks me the question is, if you're an employer with, particularly if you have critical workers, food service, healthcare, first responders, all those things, you should be moving towards mandates. We've done that at the blood center and have a higher than 95% immunization rate at the blood center. And I really think that's the most critical thing that can happen now, is that people get immunized and that employers consider whether they should require their critical workers to be immunized. That's my opinion. It's certainly not a health department opinion at this point, position or policy statement. These drugs, and particularly the Pfizer drug, that's going to be, I think, widely useful, may be a nice bridge to immunity. We may be able to prevent severe illness, hospitalization, and death with the antivirals, and they may make a really nice transition to fuller population immunity. But they need to be available, distributed, and in use before that'll be the case. My suspicion is we'll know a lot more about Omicron before that happens. Just, it takes a while. I know that Merck has distributed their drug already, but we need to see the EUA, and it's not going to be as simple as we would like to use, because certainly women are going to need to know if they're pregnant, and there's going to be caveats about its use. None of the drugs that are coming down the pipe are going to be immediately available for kids, which is where a lot of infection and transmission is coming from right now. So I keep falling back on masking, distancing, reasonable hygiene, the things that we've been doing in addition to primary immunization.
Thank you. Dr. Olutade, there's a question here for you. Are our health systems likely to see a shortage in things like ventilators and beds with this new variant? I know Dr. Katz has shared that we're still learning much about this, so it might be just a hypothetical question, but what has been the environment at the hospitals?
Yeah, thanks. One of the things we see with the increasing number of patients is that, of course, it's additional strain on the health systems. But I would say that we are much better prepared than we were 18, 20 months ago. Right now, we have very good system. We collaborate with other health systems. We have dashboard to monitor the supplies and supply chain and see where the things are needed the most. So ventilators, we can exchange. We can get it from our partners across our health systems and even across health systems. We work very closely with the state emergency management agencies to identify potential shortcomings. But our supplies are much better right now. Staffing wise, it still remains a challenge. As you know, it's a nationwide challenge with the healthcare workers. However, we've kind of been able to stabilize things. Of course, if we get busier, it to be some strain. However, we're able to redeploy staff and resources as needed. So it's one of the things that we've learned quickly during this. Our emergency response is much better, much agile. So we're able to provide care to the community, and because we have adequate resources, adequate staff, we're able to move resources to where they're needed the most. And talking about hospitalizations, we know that one of the other ways we can reduce hospitalizations is to get tested early enough when your symptoms, if you have symptoms that are compatible with COVID-19. Early testing would offer you other treatment modalities, so people can get the monoclonal antibodies to prevent hospitalizations. We can, even when people get hospitalized, they're not as sick because you can start some other treatment with the remdesivir and the steroids early enough before people are critically sick. So it's important not just to stay at home and wait it out like common cold, but we should get tested and check if we really do have the COVID-19 infection, because then you have more opportunities to really attack it early on and prevent hospitalization.
Thank you so much for taking that last question. I think that's a great spot to stop here. So thank you to our media partners for joining us on today's call. We are recording this. It will be posted onto our website, our social media pages, and shared broadly. So we appreciate your assistance in getting this information out with our community. Thank you to Dr. Katz and Dr. Olutade for being here with us today. We're grateful for your advice and your guidance throughout this, and wish you the best as we go into this next phase. Thank you all. Have a great afternoon.
Thank you.